I do like hiking. I just never seem to actually.
Good morning, folks.
Morning.
We'll give folks a few minutes to show up today. I know it's the last few weeks of summer, so I'm sure there'll be a lot of folks missing. I know there's a group of ECDC folks up in DC this week, so I'm glad everyone who's here is here today. Just give it a few more minutes. Good morning, folks. People showing up now. We're just going to give it a few more minutes as people arrive. Still Monday morning.
Good morning.
Good morning, everyone. Just giving it a few more minutes for people to show up.
Were we scheduled for today? I don't know that I would have scheduled that. I have another.
All right, well, I think we can get started as more folks come in. Welcome, everyone. My name's Alex Beck. I'm the Working Communities Initiative Director here in Southern Vermont, and this is the New Vermonters Provider Network meeting. So if you are someone who, through the course of your day or work, engages with or supports New Vermonters, you're in the right place. Normally, we start with some updates from the state, and I see that Tracy isn't on yet, but I do see Allie Perline from the Refugee Health Coordinator's office. So welcome, Allie. I don't know if you have any updates. I know there was something we had shared a bit earlier. I don't know if you want to start and just dive in and introduce yourself, or if we should maybe have an update from ECDC first.
Hi, Alex. Either way is fine. Why don't we give an opportunity for updates first, and then I'm happy to talk a little bit about my piece and to have conversation after that, if that works.
Great. Thanks so much. All right. So our folks from ECDC, you are up, and I believe, Ursula, you're providing an update today.
Yeah, hi. Good morning, everyone. So as Alex already said, most of the staff are out at a conference with headquarters in DC for this week. And reading from my notes from Joe, for any general questions, please reach out to me. And finance-related questions to Gail Summers. I hope everybody has email addresses, or I can put them in the chat in a few minutes. If you can wait, obviously people will be back next Monday. So on arrival updates for the June through August period, Brattleboro, we've had in the last 3 months 2 arrivals, one a Syrian family of 5 and a single Eritrean woman. We expect a Congolese family of 8, a single Congolese man and a single Afghan man arriving in August and September. That's for Brattleboro. In Bennington, for the same period, June through August, had 6 arrivals, 4 Afghan and 2 Congolese. One of the Afghan already outmigrated. In August and September, we expect an Afghan family of 6 and a single Congolese. So for other updates, Eduardo Melendez is no longer with ECDC as Community Engagement and Communication Manager. If anybody is working on a specific project with Eduardo, please contact Joe. Obviously, the hiring process is moving ahead. Our summer program, which is focused on education and self-sufficiency, is ongoing here at the MCC. We have programs for summer camps, a teen space, ordered books in the clients' languages, games, and we have set aside a time where teens can come together, get to know each other, and maybe even practice English. We've had continued ESL for beginner learners, and then moving on to computer literacy for beginner learners, a waste management program, campus visits, food safety, and possibly museum visits for newer clients. Okay, so here's a request. If any Ukrainian in Orange, Windsor, Wyndham, and Bennington counties are looking for assistance, they should contact Mark Clark. And any Cuban or Haitian that was granted parolee status, or if they don't know what status they have and are residing in the same counties, Orange, Windsor, Wyndham, and Bennington, they should also contact Mark, and he can help determine if they qualify for our services. And that's it.
Great. Any questions? Big picture, little picture, that relevant to ECDC right now? I will note that our next month's meeting will be the quarterly consultation, which is a quarterly event in which partners can talk more specifically about the pace of in-migration, how that's been going, and different folks from different specific sectors can provide that input generally. But so any pressing issues, anything that's been bubbling up of late, sure. Yeah, Sean Marie.
So thank you for that update from ECDC. When you said that you were expecting in the Bennington area 6 and 1, was that September, October, or I didn't really catch the time frame? I know that you had just done through August. So was that just
August.
September?
August and September. Afghan family of 6 and a single Congolese.
So you don't have anything past September?
I don't have that, no.
Okay. Okay, thank you.
Since we were talking about, Alex, you were talking about the pace of arrivals. I just wanted to note that there were 3 Afghan families that arrived before the beginning of August, and 1 more that arrived last week, and 1 out-migrated. Plus, we've got the Congolese family.
Great.
And the staff has dwindled to 1 20-hour a week position and 1 15-hour a week position.
Thank you for that. Yeah, I think, as staffing continues to change for many of our organizations and institutions, it's really important to update partners on who best to talk to, when, about what. And so just making sure we're keeping all of our sidelines of communication open as well as during these meetings. Great. The next thing I wanted to touch base briefly on is just a little bit of some big picture workforce updates on our end.
Okay. Oh, my goodness,
and
okay.
and one thing that I was hoping Tracy was here to share my appreciation with is that we've been working with the refugee coordinator's office around some workforce exams, whether it's nursing or commercial driver's licenses or other examinations of things that folks might need to take to do things like drive or enter a certain industry. So we've been working really, I think, fantastically in changing some of these policies statewide, in allowing for folks who are taking an exam to be able to do so in their native language. It's tricky, and for the nursing board agreed to have their vendor for the LNA training allow language accommodation. That was one way we did it. The other way for commercial driver's licenses, I believe, is the examiner can have an interpreter or translator, but the students can't. So it's that, someone can't say, tell me how to do blank, and then the interpreter or translator will speak in their native language on how to do that. But really, can someone repeat the instructions, or can the proctor explain something, or that's how they've established that. So it's been a fascinating way to learn about how we regulate and certify different professions, and this different flexibility different professions have around that. So that is statewide policy changes that is largely being driven by our partnerships here. Co-sponsors have been involved as well in really sharing some of these burdens. So that's been great. I don't know, Amir, anything else on workforce development you can think of? Sorry to throw you under the bus.
Well, that's fine. No, I don't have anything to share as of now. Yeah, thanks though.
Right. And most folks already know that folks who are interested already know that there's a CDL permit test course happening, as well as an early childhood education class that will be finishing in October. And so that's exciting all around. Any questions on that? Great.
Alex, how many students ended up in your early childhood class?
Yeah, so there 8 students ended up enrolling.
Awesome.
Yep. And that was let's see, there was 8 students enrolled. 2 will end up having out migrated by the time the class ends. And so we've learned some things the hard way about this course doesn't have like portable credentials if you don't complete it. So we've just learned that if someone had taken it through CCV, there may have been college credits that they are able to bring with them to a different state or country. But because of the model we use, that is one drawback. So we're learning about that because people being educated in other states or other countries is often a challenge we find in people just being able to access jobs they're already qualified for. So yeah, so we're hoping for 5 or 6 graduates by October, which is exciting for us.
That's great. Yes, sometimes the hard way is how we learn things.
Yep. Yeah.
Well, but Alex, to be fair, it's the first time, so it's not like it's all a learning curve.
Yeah, we've learned quite a bit, and I think that's really the value of these bigger meetings. I know that there's a few folks who have been involved in supporting this, and the long-term goal is to just not make the same mistakes a second time or third time maybe in doing this work together. So I appreciate that.
Well, Alex, I will say, just on a similar note, the tutorial center is working with a young man who is taking some courses, and we've learned that sort of some of the pre-education is really, really key before they dive into some of the work training. And, I think because everyone is anxious to help people get their employment, and especially in a field that they may have been in a different country, that we have, that it does take sometimes a number of different individuals to try and figure out the best way to make that happen. That isn't always easy to explain, because it doesn't sometimes feel like you're helping. But anyway, yes, we've run into some of what you may have run into even on an individual basis. So thank you for sharing.
Yeah, absolutely. I mean, I think the biggest challenge a lot of workforce people face is, how do you run one class for a group of adults with a wide diversity of needs, backgrounds, and in this case, language abilities. And it's taken us years to talk about on-ramps and off-ramps. That's what we talk about it in the workforce world, is whether you're fresh out of high school or you didn't graduate high school, or you're an adult learner coming back, or going for the first time, there needs to be a lot of different ways you start your journey, and a lot of safe ways to pause it. And in our case, one student is likely not going to graduate and go back to ELL classes and focus on those skills before moving forward. And so part of our work is making sure that isn't seen as a failure, and that this person's support is continued through. And so I'm appreciative of all our ELL partners who are directly engaged in the training, and also aren't as directly engaged, but are also there to support folks as they go. And the hope is to replicate this with health careers pathways and a few other trainings as we can. Any other questions on that? Seeing none, I think we can hand it over to Allie. Yeah, and so one thing I had asked their office to provide an update on is the scheduling of doctor's appointments, and really the landscape of how folks are accessing healthcare as they come into Southern Vermont.
Absolutely. Thanks, Alex, and thanks for all the updates. So I'm Allie Perline, Refugee Health Coordinator. I work closely with Tracy in the Refugee Office. So an update on access to healthcare. So I'm thinking of a couple of key pieces, right? So of course, for the work that I do, much of one bucket of my work is focused on ensuring access to that initial refugee health assessment screening that folks complete upon arrival to the state. And so that's a piece. And then thinking about connection to primary care, and then some of those other pieces like mental health, dental care access, et cetera. And so, of course, as we all know, the landscape of refugee resettlement in Vermont has expanded very rapidly, right? Just in the last year and a half, 2 years or so. And so that has required a lot of being flexible and working in real time, trying to be creative in terms of working in a landscape where our healthcare provider capacity is already limited, right, statewide and also nationally, right? So trying to look for opportunities for partnerships and ways to ensure that folks are getting connected to care in ways that are linguistically accessible and culturally responsive, and hopefully not too far from home. So what I was thinking of maybe doing, I don't know, I can try to share my screen, but I was thinking of just having a little bit of a visual might be helpful versus trying to just ramble through it all, since it's just a little bit of a summary table. So let's see if I can do that real quick. See if I can pull that up for you. Okay. Are you all able to see that?
I see that you're sharing your screen, but right now it looks blank. Oh, there we go.
Oh, okay. Just taking a minute to, let's see, and if I can focus that, maybe that'll help a little bit, because I know Word documents are usually pretty tiny when you try to screen share. So in any case, so this is just kind of a current summary for kind of the key players for Brattleboro, Windham County, and Bennington counties. And again, so this is really capturing kind of the key players right now. So, and I can just kind of walk through this a little bit, and fully recognizing that primary care and capacity for the DHA, the domestic health assessment, is really limited right now. You know, I think access to the DHA and provider capacity for the DHA screening is a challenge nationally right now. And again, I think just to wrap back around to the current landscape, right? I think we continue to ask more and more of our healthcare provider partners. And there's only so much time and energy in a day, right? So we've had to get a little creative. And I think, you know, what we currently have in place is certainly not the end all and necessarily the ideal. You know, I always have in mind wanting care and access to care to be as accessible and close as possible, but there's a lot of factors that play into that, right? So currently what we have in place for folks in Brattleboro area in Windham County. So our setup is kind of separated for access for that domestic health assessment for adults versus children. So right now we are having to connect most of our Brattleboro clients to that DHA assessment to the Bennington Free Clinic, and totally recognizing that that is a trek, right? That there isn't anything totally ideal about that. But I will also really acknowledge and appreciate the capacity of our free clinic to be a partner in this work. They've been an amazing partner in filling such a significant gap right now for Southern Vermont and having this screening done. And so that is a somewhat of a new partnership, but really we've been able to dive in. And so all of our adults right now are going to the free clinic. What is nice right now with that setup is at least folks are able to get all of the required lab work that's connected to that screening done locally. So generally that's at Brattleboro Memorial Hospital, right? So that at least they don't have to make that long trek multiple times. They can get all the initial lab work done, the screening's done first locally, and then they make a drive over for that actual in-person screening. And then, of course, primary care in connection to primary care is really a high priority, right, for adults and children, both in Brattleboro and Bennington area. And so really ensuring that then folks can then have a locally based primary care provider back in Brattleboro, which has been wonderful. And so, BMH has been a wonderful partner in working with ECDC team to ensure that folks are, able to be assigned, that adults are able to be assigned to a PCP. And so all of those results from that initial screening are sent right along to the PCP, with the goal that there's a continuity of care if anything's identified during that screening, right? That that can be picked up and then managed more locally for folks. For kiddos, right now, it's another example, right? We just are really limited on local provider capacity to help us with these initial screenings. They are really time intensive. So these appointments, right, again, they take 1.5 to 2 hours oftentimes because of how comprehensive they are. And so right now we have a pretty new partnership with Dartmouth Pediatrics. They've been a wonderful partner in stepping up and helping us out in providing access to the screenings rather than having to go, say, all the way up to Burlington to UVM Medical Center to have these screenings done. And so that's been a really, really nice partnership where there's a lot of new residents that are excited to be a part of this work and are learning the process and experience of completing and conducting these assessments. So it's been a really kind of nice opportunity for a partnership. And then again, similar with for adults that are having the assessment done at the free clinic, kiddos also are able to be connected to primary care more locally, which I think is really, really wonderful that there is still that local level capacity for primary care for kiddos. So, and then again, similar where all of those DHA results and test results are forwarded on to the PCP for that continuity of care if anything is to be identified during that screening. HCRS for mental health has been a wonderful partner to the refugee office over the last year. We're really excited to be continuing our work together, to be learning together, to be building bridges for mental health access that's culturally responsive, linguistically accessible. I think maybe I saw one of the HCRS team members on the call here. So big shout out to your team, all the amazing work that you're doing and building connection and rapport with the community. So excited to be continuing to build that capacity for that mental health capacity. You'll see that I have some notes in this table that just kind of quick comments around overall recognizing what the gaps are, dental care access continues to be challenging. Primary care, of course, is, continues to be limited. And then, of course, the ideal of having capacity to do the DHA more locally is the ideal, and something that we'll continue to strive for long term, absolutely. But keeping that kind of in mind and acknowledging that and recognizing that that is something we do hope to build more local capacity down the road. And then hopping over real quick to Bennington, what's been wonderful for Bennington, I would say, is that at least for the DHA piece, we do have some capacity locally right now, both for the kiddos and adults. So SVMC Pediatrics continues to have space for kiddos. And then Pownell campus, about 20 minutes from Bennington, there's a couple of providers there who have been really willing and able to come on board to take on refugee arrivals to Bennington, both for primary care and to help with that initial screening. So you'll see that for Bennington, we have a couple of options for adults to have that initial health screening done, both at the clinic, the free clinic, and then also Pownell campus. And then for kiddos, they also are able to, at least for now, complete their screening more locally, which is wonderful at Pownell as well. So those are two options that we have right now. I think something really to recognize for Bennington that we all are really really thinking about and being mindful of is that overall primary care capacity is really limited, right? And so something that we're really wanting to keep an eye towards. And I think it's just one of those situations, right, where providers are continuing to leave practices, and so we're having to make do with what we have. Mental health access, so UCS is going to be coming on board as a new partnership and kind of mirroring the model that the Refugee Office has implemented in a partnership with HCRS, which is really exciting. So we're really excited that we'll be able to build partnership there and connection, and I think really be able to build support and capacity for more culturally responsive, linguistically accessible mental health care moving forward for that community as well. So so I think all that to say, really focusing again from the lens here in my role around that initial screening, primary care. I continue both for both areas, Brattleboro and Bennington, trying to look for and come up with other options for both primary care and that initial screening. I've been working with some of my other refugee health coordinator colleagues in New Hampshire and New York and Massachusetts, right, kind of our borders, looking for any existing capacity there around potential for partnering with providers, either for primary care or perhaps for more locally based access to that health screening. Of course, a number of our out-of-state healthcare partners accept Vermont Medicaid, which is what is able to fund the health screenings for folks. And most of our refugee arrivals are Medicaid eligible and enrolled. So at least for that initial health screening, right, that the cost there can be mitigated. So always trying to keep an eye towards other potential healthcare partners that are able to be a part of that system to ensure that there's no cost burden for our clients. So I think I'll pause there. I always feel like it's just kind of a lot of rambling when I'm talking through and summarizing a table like this. I'm certainly happy to answer questions. If folks have other thoughts and suggestions on other healthcare partners that might be interested in this work, I always welcome suggestions, new connections and introductions. I certainly do my best to work with the local health offices for the local level connections to FQHCs, to the free clinics, to our regional hospitals. But any connections that you all have and thoughts that you have, I always welcome opportunity to bring on more folks into our refugee health network in the state. So I'm going to pause there. It looks like maybe can't see the questions in the chat when I'm sharing my screen. So maybe I'll stop sharing and then we can have some conversation if you'd like.
Any questions? Yeah, there were some recommendations in the chat. Thank you, Sue, for that.
Yeah, great.
Any questions about health care access?
Yeah, Sue, I see your note around North Star. Yeah, so I recently just reconnected, at least with their current capacity. They've their current response was that they don't have space for taking on primary care or for helping with the health assessments. But looks like maybe, as you mentioned, maybe they are going to be expanding soon. So maybe that will help shift that landscape for them capacity wise. That's good to know. Actually, I didn't realize that was in the works. And Dr. Burdick, yep. So Dr. Burdick has been wonderful at Pownell campus, working closely with us to welcome new folks. But it looks like, Grace, I see your comment. Sorry, that was just a note that you were making. So good context.
Great. Yeah. Thanks. Oh, and then of course, Grace Cottage. I don't know if there's been engagement with them. I know, but that's also a great reminder.
Oh, that's a great thought. I haven't connected with them. Thank you. If anyone has any particular connections or suggestions on maybe who to try to have a conversation with there, I again welcome introductions, but I'm also happy to reach out and to see if I can have a conversation, explore any possibility there. So thank you. And yeah, the free and the free clinics. Yeah, Sue, thank you. And that is something to take note of around our partnership with the Bennington Free Clinic. Is that, for the most part, our model here in the state, because again, most of our newcomers are enrolled in Medicaid, right? So the health screening is billable to Medicaid, which is wonderful. And so working with a free clinic where they can't bill for Medicaid, we've been able to get a little creative and build some contracted partnerships to support with some of the staffing capacity that's required with that work. So, and that certainly seems to be working well. And we have some fine tuning to do there, but it's been a really nice partnership and a new piece of how we're able to, add capacity for the screening. So.
Brattleboro, just for clarity, the Brattleboro Walk-in Clinic is not part of that network of
Okay.
Vermont Free and referral clinics. I don't know why. You could have to ask them, but they don't bill for any of their services. But
Okay.
so they're an outlier, which we tend to be here in Brattleboro. So just know, they're not on the map, if you will, for the free referral, but they are open every Tuesday and they're actively, they don't take appointments. So it is a walk-in. So it just it may fill a need in the Brattleboro area. For this population that could be beneficial if they're willing to sign on to the domestic health screening or other types of, work. So
yeah, thanks for the suggestion. I will definitely look into that. Thank you. Again, anytime there's opportunity to explore more locally based capacity, I'm very excited to do so. So
great. And on the note of capacity, I don't know, I guess if I'm a hammer, everything's a nail, but from a workforce development perspective, we're looking at improving both the amount of care available and the quality of care by ensuring our health careers pathways are accessible to new Vermonters. So that is, we know that both more healthcare providers means more folks can get access to healthcare, and that the better our healthcare provider labor force represents the folks that they are caring for, the better outcomes are. And so there are groups from like the NAACP Health Justice Committee is doing some great work on that end. The Diverse Workforce Development Group is also doing work on the other side of that coin. And so that's other things that we're actively exploring in terms of healthcare and access in our region. A slightly longer timeline because folks need to get trained or credentialed or their credentials evaluated or approved, but that's part of how we all ensure we deliver high quality care to all new Vermonters. So have to put that in there when I can.
And Valley, sorry to just jump into Valley Health Connects, which is up in the Springfield area and works pretty closely with North Star. I think it's just a great resource as ECDC, I think, thinks about, kind of Northern Windham County or Southern Windsor in terms of resettlement. I think they're just a key player, particularly if there's a North Star expansion. I don't know the timeline on that, but it's been publicized that they are expecting to expand into Brattleboro. So again, some of those regional resources might be more helpful as that comes to fruition on this side of the mountain. So
that's great. Thank you all for the recommendations. I appreciate it. And please do reach out at any time if you have questions or concerns. I appreciate everyone's lens towards wanting, towards accessibility, right? I mean, thinking about access in terms of driving and the amount of time that we're asking folks to take in terms of these initial screenings and potential wait times and access to primary care. So I appreciate everyone's eye towards that. And I'm happy to have conversations and to do brainstorming and to share any information that I have with you all if questions come up along the way. So.
I would just like to express our appreciation, Allie, for all your work with us, the coordination and the assistance and the support. Thank you very, very much.
Thank you. It's been a wonderful partnership. So thank you for your work.
Yeah. You know, I say it a lot, but the point of these meetings is so you know who to call when you need to do a thing, and folks answer and do the thing. And that's something that's uniquely excellent, I think, about Vermont, is that, you know, we are literally a phone call or Zoom away from our state offices and our state agencies. And again, whether it's mental health or credentialing, it's been helpful. So when in doubt, give someone a call, reach out to me if you want someone's email or contact that you heard a thing at the meeting the other day and you want to follow up. That's exactly what these meetings are for. And yes, could not celebrate Emmett's comment more around transportation access. So, you know, if you have a Medicaid funded appointment, you can get a free ride to that appointment using the mover with enough planning ahead of time. And so just if you're in the logistics around you know, health appointments, that's a really great resource to be aware of. Any other questions or comments? Anything new, exciting, challenging?
This is Emmett. I just want to add that the specifically neighborhood connections, which what I just sent through the Mountain Town Connector, they have a new van, a year or so old, but the van can take a lot of people and use a lot of fuel. So they've hired and are paying drivers as well. So there are a number of drivers with their vehicles that are approved and insured, and they have the van, and it's anybody, and it's not really that specific. What Alex just talked about is true. It is specific, but they have a wider open general funded type thing. So out here where we're the furthest away from those services, there is now better available communication, transportation.
Great. Thank you, Emmett. Any other questions? Great. All right, well, it looks like we can wrap early today. A reminder that next month's meeting is a quarterly consultation. But if between now and the following meeting, there's something comes up, you know, an exciting development, a challenge you're experiencing in your day-to-day, send it to me, and it's something we can do a deeper dive around. Even if it's a problem you've already solved, how you solved it may be really exciting or important for other people to hear. Because they may have a similar problem that has the same solution, or I didn't know I could call this person to do that so easily. That's the kind of thing we like to hear about. So as always, send me anything you'd like, and we will talk to folks soon. Have a great end of your summers. Thanks, everyone.